that this is the last and concluding poster session, but it's still very interesting. So the four poster presentations, the Q&A, if anybody has, which we'll be discussing. The first is from Dr. Sanjay Kumar Kanodia, and he's from Jaipur, and that will be on the role of topical methotrexate 1% gel in localized vitiligo. The other is from Dr. Paras Choudhary, and he'll be, of course, talking about microneedling with, he's already presented a poster on microneedling with topical 5-fluorouracil in the localized stable vitiligo. Is this the way out? Our experience. And Nicoline Post, does autoimmune vitiligo protect against COVID-19 disease? And finally, by Alexandria Brown, and that hers is high frequency of photosensitizers in products marketed online for vitiligo. Now, you can, in fact, for everybody, you can view the posters. There is a link that has been shared with by Patrick Dawkins. So if anybody wants to have a quick look at the posters, please do click on the link that is given, and you could look for Q&A. But meanwhile, I think, do we have all the poster presenters here? I can see Dr. Sanjay Kanodia. Hi, hello, how are you, Sanjay?
Good evening.
Good evening, good evening. And I can also see, I think, Dr. Alexandria Brown, she's here. So two of you are there. So perhaps, we start with the two of you, meanwhile, maybe the others join in. So Dr. Sanjay, you had an interesting poster presentation, isn't it? About methotrexate gel, which you've used for, focal vitiligo, isn't it? So,
definitely.
What I wanted to ask you here, because while we wait for questions to turn up, is that you used a methotrexate gel, for these lesions, I think over a 6 months period. What methotrexate gel actually did you use and all? Was this commercially available? Did you compound and make that? That is something that, we would be interested in hearing.
See, in India, we are having this methotrexate gel from last 3 years only. And it was marketed last 2 years back. And probably this is the first of its kind of study in India itself. We searched literature for the same, that and how we get stimulated by that, because one or few of the patients came down with tacrolimus and saying that there is a black box warning has been there. So this stimulated us to have a molecule, to have some of safety features. Though every of the molecule is having good safety features, but this methotrexate is a novel molecule which we wanted to use. And definitely, if you see our results, then almost 3 of the patients, what was very promising was 3 of the patients had more than 90% of clearance. And if we cumulate all the patients, then almost 50% of almost like 14 of the patients had more than 50% of results were there. So this was a very promising study, and we need more of studies to go ahead with the same.
Yeah, so Sanjay, maybe, you could just summarize, in a few lines for the, other viewers who may not have read, your poster, because I have done that, maybe just in 5 lines, just summarize, just give the highlights, for the benefit of everybody.
We used topical 1% methotrexate gel, which was commercially available. And there were almost 38 of the patients who completed the study. And it was almost in the p-value for the same was very significant. And in almost 14 of the patients, we found that more than 50% of improvement was there. And we found best results in the facial vitiligo in these patients. And only 1 or 2 of the patients had erythema, which was on the higher grade. And it was not so significant that we needed some kind of some topical therapies or some kind of therapies to reduce the same. So it's a new kind of study, a novel molecule to study on for the same.
And you had a 6 months period, isn't it? To do the study.
We studied
followed
for
it
6
up
months.
6 months. Yeah.
6 months the study was there. Definitely.
Right. So I see that Dr. Davinder Prasad has raised his hand. So Dr. Davinder, do you want to ask any question or any comment?
Yeah. So Sanjay mentioned that this is black box warning against tacrolimus. So probably what you, place versus tacrolimus, do you think is going to replace tacrolimus as a management of vitiligo, or
No, no.
it's just another option?
Good day. Yeah, definitely. It's on the part when those patients came up, those were searching internet. And in today's scenario, where we are using our molecules, in India itself, there are more and more of cases of consumer CPA, Consumer Protection Act has been there. So it was one of the stimulating point that we have to search some new molecule. So definitely, it's not going to replace tacrolimus. No, not like that. We have to. The time is the only factor, and more studies are needed to see how this molecule works. But definitely, this is one of the alternative armamentarium where we can use it as an optional therapy for stabilized vitiligo. We actually studied in only stabilized vitiligo. It was not an unstable vitiligo. The VIDA scoring was +1 or +2. But let us see, let us hope that this message which we want to convey on this platform, that it could be one of the molecule which we can study other than tacrolimus and other things.
So thank you so much, Sanjay. I think it's a novel study.
Thank you so much.
We, of course, yeah. I do just hope that, because we know that methotrexate otherwise also is a pretty good, drug and immunosuppressant, once we have given many pulse and also that way it is
Definitely.
good even as a systemic agent. But yes, time will tell, because this is probably the first study that you have done. So congratulations for that. And
Thank you so
I'll
much.
now go over to Dr. Alexandria Brown. You had an interesting paper, about photosensitizers in different products which are available, on Amazon and other sites, and, whether they could possibly have a role, in making deterioration of vitiligo. So could you just summarize your paper, maybe in a few lines, for the benefit of the viewers,
Yes, definitely. Okay, so we looked at products being marketed and sold online for the treatment of vitiligo for the presence of known photosensitizers. So basically, we went on Amazon, had these search terms, vitiligo treatment, repigmentation cream, vitiligo ointment, vitiligo cream, and saw from our search results that we looked at only topical repigmentation products that were marketed to repigment vitiligo. We didn't look at any camouflage products like tanning oils, anything like that. And then we also looked at oral supplements. And so of the set, we found 17 topical repigmentation products that were on Amazon. 53% of those, 9 out of the 17 contained one or more photosensitizing agents. And that include things like Sorrellia, Angelica sinensis. These are kind of called plant extracts. Amimagis, bobchi seed oil was a really common one. Or they would just say sorlin in it, for sorlin containing.
So bobchi is something which is quite, in India also, it's there in a couple of products. But on the other hand, it's also used, in treating, vitiligo. On the other hand, it's a photo. So that is what it is being used for.
Yes,
So,
yeah. Yes, yeah. So we know it's treated. We just kind of wanted to shed light on these products and say that they should be used under supervision. Some of the comments and some of the products, people were saying that they would go out in the sun for lengths at a time and get these phototoxic reactions, the bubbling. 3 comments, 3 people claim to require hospitalization. Obviously these are just Amazon comments, so we can't hold super weight to them. But yeah, just to be aware of photosensitizing compounds in these products, and then to always just check in with your doctor for the products you're using and how long you should be in the sun after them.
Okay. So any questions from the house? Because I think she has quite an interesting and very relevant study. Anybody, any of the faculty here or any of the presenters would like to ask any questions to Alexandria?
Not a question, just a comment, Alexandria. Great study. I suspect this a lot, that the over-the-counter things that they put in these chemicals that will sensitize the skin. We know that Puva and Puvasol are very effective for vitiligo. But we also know that they're really dangerous, right? They increase the risk of skin cancer significantly. And we've been using these since the Iron Age in India. It's fascinating for thousands of years. But I agree with you that putting them over the counter is not safe, and they really need to be used under supervision.
Yeah. And Amazon, I guess, a lot of products on Amazon aren't like regulated by any sort of means. So it's just important to keep an eye on that and like ask your patients about any products they're using over the counter. But
Also,
yeah,
was an
thanks for that
interesting idea to look at the comments, because you can get lots of comments on products. So the fact that people were saying they were hospitalized or got blistering sunburns, I think that's really important to note. And our patients are using these.
Yeah. Thank you.
Thank you. Was that John? I think it was John Harris.
Yeah.
Sorry, yep, that
Yeah.
was me, John Harris.
Okay.
Yeah.
So are there any other comments? Any other comments?
Yes,
Anybody
yes.
has?
As John said, I mean, we should expect that those commercial products, when they are effective, they should contain an active ingredient of what we are working with. It would either be something that works with the sun, or sometimes I suspect that it might contain some glucocorticoids within it, and they don't say that. Usually, commercial products that are effective probably will have some ingredients which are used medically.
Yes. Yeah. We saw that. And yeah, a lot of times we'd have to go to the manufacturer's page to double check to make sure all the ingredients were listed correctly on Amazon. But yeah, so kind of what we expected.
Yeah.
I actually had a patient,
think-
this is John again. I had a patient, 14-year-old boy who was in the US, and I prescribed narrowband UVB and tacrolimus for treatment in the genital area. And he and his parents visited India and saw a dermatologist there, a doctor there, who prescribed Puvasol. Gave him a cream. Actually, I think it may have been Ayurvedic. And so they came back and said, why didn't you give me this cream? Number one, they said, well, this work. And then number two, why didn't you give it to me? And it was a very difficult conversation, because clearly, yes, it would work. I had to admit that Puvasol in the genitals, if you exposed it to sunlight, would work. Vitiligo would improve through marginal repigmentation, but then had to get into all the data on PUVA and skin cancer and the risks. And it was funny, the 14-year-old was a brilliant kid and said, all right, I'm not using it then. And he was able to kind of process all that data, but it's not an easy conversation. It's pretty complex.
Yeah, that's super interesting. Thank you.
I think there's a comment from Caroline, and that is another point is that UV is also implicated in disease precipitation. Wavelength may be important. Do you think so?
Yeah, I think so. I think from my knowledge of Puvasol and stuff, it's like very, they like measure the time of day, what the wavelengths would be, like how much time you should be in the sun. And if people are just going out on their own, like the sun is obviously very unpredictable. And yeah, you never really know what you're going to get.
So, okay, I think, if we do not have any more questions, I don't think the other two presenters are there. So I think that should be all, for the poster session for today. Thank you so much,